She's done a bang-up job, hasn't she?
Yes, and a new book coming out tomorrow by Robert Hardman, which is looking at the king, but also the relationships within the royal family, between the king and his son, and also his daughter-in-law. And that sets out just how much admiration Charles has for his daughter-in-law, Kate. Not just for the way in which she's adjusted to the role and that new senior position of the Princess of Wales, and that she's found causes that she's very passionate about, the early years, for example, mental health, looking after young people, but also the way in which she's bringing up his three grandchildren, George, Charlotte and Louis. And I would echo what has been said by Jenny, that she is a mother of three young children, and to be away from them in hospital to 10 to 14 days will be very difficult for her. And we have, as you would have in any family, William taking time off to be at his wife's bedside, but also to look after the children and maintain as much normality for them as possible.
I think maybe this comes as such a shock to everybody, partly because Kate always appears to be so super fit. You know, anything that involves running, catching a ball, rowing, anything that's kind of physically involving, she's incredibly good at. Her sister Pippa Middleton also terrifically, you know, was competing in a marathon or climbing the Himalayas or something. They're a very physically fit family, aren't they?
Very sporty, very fit, very active. And as you say, on any engagement where there's a chance to get stuck in with some kind of sporting activity, she does that. We last saw her on Christmas Day at Sandringham, looking well. We haven't seen her since. They do describe this as a planned operation.
Would we normally have seen her between Christmas and now?
I don't know that we necessarily would have done, because they take the school holidays off. It was her birthday last week. Yes. She spent that at home with the children, we understand. The children went back to school towards the tail end of last week, so it may not have been that we would have seen her anyway. But there was a busy calendar of engagements planned for this early part of the year. There was talk as well of the couple undertaking an overseas visit, potentially to Italy, for example. And we're told that is now not going to happen. There will be no international travel for the foreseeable future for the couple. 2 to 3 months worth of recuperation at home for the Princess of Wales after she returns from hospital. So it will be at least Easter before we see her. And then when she returns to public duties, will be very much done on the advice of medical staff.
And I wonder if there's any precedent for you know, a young member of the royal family having to withdraw from royal duties for a quite considerable period of time because of ill health or recovering from a major abdominal operation or major operation of any kind, in terms of, you know, how much they're likely to brief the public, so many of whom will be really concerned about her and will really just feel nothing but good wishes for her and you know, hopeful for her speedy recovery. Whether the royal family are likely to give more information, whether they'll never give any information, whether it'll come out gradually, you know, that kind of thing.
Yes, well, Kensington Palace have already been pretty clear on this, that they will only give updates on the Princess of Wales's condition when there is significant information to impart. I think they're keen to get away from giving a running commentary on a daily basis around her health. I mean, we've seen other members of the royal family. I've spent many a day standing outside various hospitals, largely the King Edward VII Hospital in London, as the Duke of Edinburgh, the late Duke of Edinburgh, and the Queen had been admitted there on occasions, for example. And again, the same comment, they are entitled to privacy. They may be a member of the royal family, but they're entitled to medical privacy. There is also a public interest, and that is why this statement was put out. And the Princess of Wales herself understands the level of interest in her health and the degree of concern that this will have caused, but has asked for that privacy to be maintained for her, but also for the children as well, who they are trying to keep things as normal as possible and as stable as possible at home for them.
Absolutely. And fortunately, the Middletons live nearby.
Yes, very hands-on grandparents, Carol and Michael Middleton, and I think it is very likely that they will step up and they will be involved and they'll be helping out with the school runs, because William and Kate both try to do as many of the school drop-offs and pick-ups as they possibly can, to be there for their sports matches and their concerts, for example. They won't want the children to miss out because of this period. And it's going to be a long period where Kate is out of action. And so I think we'll be seeing Carol and Michael Middleton really getting involved and helping out, as they do privately behind the scenes anyway.
And so we have this strange juxtaposition, really, of events whereby Kate is now unable to work and won't be working for some months. Prince William, I think, to most people's real delight and comfort will be with her, bringing her delight and comfort. You know, he will be working much less and able to fulfil far fewer engagements. The king himself is hors de combat with his enlarged prostate in that procedure. So there is a very careful and delicate protocol about what happens next, and people who are designated to fill in the gaps.
Yes, councillors of state, they are those that deputise on important business, usually government business, state business, for the monarch when they are unable to do so themselves. So that would be the Prince of Wales. It would be Camilla as the spouse of the monarch. It is also Prince Harry. It is also the Duke of York and Princess Beatrice. Now, Prince Harry, obviously in California, the Duke of York, no longer a working royal. So in the last year or so, we've had 2 more councillors of state added, and that is the Princess Royal, Princess Anne, and the Duke of Edinburgh, Prince Edward. So there are other members of the family who can deputise. And while Prince William is obviously taking time off from formal engagements to look after his wife and children, I think should he be required to undertake anything particularly important, he will, of course, be there. The King's procedure is very routine. It is very common. As we heard from Dr. Philippa Kay in the last hour, 50% of men over 50 will undergo this kind of condition and will require treatment for it. Many of them will require treatment for it. And Philippa's suggesting 1 to 3 days of recuperation, during which time he'll still be getting his red boxes, he'll still be working, he just won't be undergoing public engagements.
Yes, and as far as the Duke of York and Princess Beatrice are concerned, is it likely that they might be called upon, or is there kind of preference for Princess Anne and
I think it's highly unlikely that the Duke of York would be called upon, but we do now have the Princess Royal, Princess Anne, and the Duke of Edinburgh, who could be called upon should they be needed to do so. And so it was a bolstered lineup. Normally you have 4 councillors of state plus the spouse, Camilla. They've now gone up to 6 plus Camilla. And you can see why that needed to be put in place when you've got Harry overseas and the Duke of York no longer a working member of the royal family.
Certainly.